Welcome to this comprehensive guide on concussion and vision for adults. Today we'll explore the critical connection between traumatic brain injuries and visual function. We'll cover the symptoms you need to watch for, the risks involved, and most importantly, the crucial role that vision plays in concussion recovery. Understanding these connections can make the difference between a full recovery and long-term complications. A concussion is essentially a violent shake to the brain, making it the most common type of traumatic brain injury. These injuries are typically caused by sudden blows to the head or whiplash movements that jolt the brain inside the skull. What makes concussions particularly challenging is the microscopic damage that occurs at the cellular level. This micro-shearing of brain cells and axons happens on such a small scale that it often doesn't show up on standard MRI or CT scans, making diagnosis difficult and requiring careful clinical evaluation. If you've had a concussion before, your risk of experiencing another one increases significantly. While common risk factors include falls, contact sports, and accidents, the most critical factor is having a history of previous concussion. Here's where vision becomes crucial. Untreated vision issues from your first injury can actually lead to re-injury. When your visual system isn't functioning properly, you're more likely to misjudge distances, lose balance, or fail to see hazards, creating a dangerous cycle of repeated injuries. Concussion symptoms fall into three main categories. Physical symptoms include headaches, nausea and vomiting, dizziness and fatigue, ringing in the ears, and blurred vision. Cognitive symptoms manifest as confusion, memory loss, difficulty concentrating, delayed responses, and amnesia. Emotional symptoms can include irritability, anxiety, depression, sleep disturbances, and mood changes. It's important to note that these symptoms can appear immediately after the injury or be delayed by several days, which is why monitoring is essential. Light sensitivity is one of the most common and distressing symptoms following a concussion, representing a fight or flight response from your nervous system. After injury, your pupils may remain dilated, making light painful and overwhelming. Fluorescent and flickering lights are especially bothersome for concussion patients. This heightened sensitivity indicates that your nervous system is in a state of shock and heightened alert, struggling to process visual information normally. Two major vision problems significantly impact daily life after concussion. Blurred vision occurs when lens spasm makes focusing difficult, causing your vision to fluctuate between clear and blurry, often triggering severe headaches. Double vision happens when your eyes fail to coordinate as a team, causing objects to appear in wrong locations. This creates disorientation and makes reading nearly impossible, affecting your ability to work, drive, and perform everyday tasks. Three interconnected vision problems lead to increased clumsiness and falls. Visual tracking delay means your eyes move too fast or too slow, causing tracking to skip instead of moving smoothly, making it difficult to judge the distance of moving objects. Decreased depth perception occurs when your eyes fail to work as a team, making it hard to judge distances accurately. Peripheral vision problems create tunnel vision, reducing your awareness of surroundings and increasing anxiety in busy spaces. Together, these issues combine to cause increased clumsiness, more falls, and significantly reduced confidence in daily activities. Vision is truly the brain's dominant sense, and the statistics prove it. 70% of the brain is dedicated to visual processing. 80% of all sensory input is affected by vision. And critically, 90% of traumatic brain injury patients experience some form of vision dysfunction. Here's the most important warning. Untreated vision problems can persist for 20 to 30 years if not properly addressed, emphasizing why vision care must be a central part of concussion recovery. Knowing when to seek medical care is crucial. For general guidance, see a doctor within 1 to 2 days for any head injury. Children and adolescents need specialized pediatric concussion evaluation. Request a vision evaluation even without obvious vision symptoms, and consider a neuro-optometric evaluation for comprehensive vision assessment. However, call 911 immediately if you experience worsening headache, repeated vomiting or nausea, loss of consciousness lasting more than 30 seconds, unequal pupils or vision changes, slurred speech, seizures or convulsions, weakness in arms or legs, or confusion and disorientation. Recovery from concussion is a gradual process that requires patience and professional guidance. Gradual return to activity must be supervised by a healthcare professional. Never return to play or work while still symptomatic. The good news is that proper treatment can restore visual function and significantly reduce your future concussion risk. Be aware of second impact syndrome. A second concussion before symptoms fully resolve can cause rapid brain swelling and death, making complete recovery essential before returning to activities. The Neuro-Optometric Rehabilitation Association can help you find specialized vision care professionals in your area who understand the complex relationship between concussion and vision, ensuring you receive the comprehensive care you need for full recovery.